My name is Elsie Lopez Macias, and this is my case study 2. An overview of the client that was mentioned in case study 1. This is a male 4-year-old African American who's diagnosed with autism spectrum disorder with potential diagnosis of attention deficit hyperactivity disorder or ADHD. Behaviors concerns that were mentioned in the first case study were noncompliance, elopement, biting, climbing, unsafe structures, headbutting, inappropriate private play, physical aggression, property destruction, screaming, SIB in the form of hitting his head, and swearing. These behaviors are current target behaviors meant for reduction, but the following slide will discuss behaviors that were observed in the time of the assessment. At the time of the assessment, these are the behaviors that were observed. So for noncompliance, that is defined as any instance where the client engages in objection or refusal when demand is placed. An example of noncompliance includes stopping mid-transitions or shrugging off prompts when prompts are provided. A non-example of noncompliance is eloping from mid-transition or verbally saying no. Elopement is defined as an instance where the client leaves therapist's side farther than 3 feet without permission or notification of actions being done. An example of this includes running or walking away from directions demands given. A non-example includes chasing a ball when playing in the gym or playing chase with peers. Climbing unsafe structures is defined as an instance where the client's feet or body is lifted off the floor and attempts or succeeds on placing body on furniture. An example of this is climbing a bookshelf, standing on a table, or walking on the window ledge. A non-example of this includes climbing jungle gym or climbing a rock wall. For headbutting, that is defined as an instance where the client uses his cranium to push another person. Examples include using their skull to nudge another person or running head into another person's body part. A non-example of this includes placing two people's noggins together in an affectionate gesture or accidentally bumping heads with others during play. To continue on with behavioral definitions for this client, inappropriate private play is defined as any instance where the client touches personal area in public. An example of this includes reaching towards private area when being changed in the bathroom. A non-example of this will be wiping self after using the bathroom or using hands or washing their body during a shower. For physical aggression, that is defined as any instance where the client causes harm to another person in the form of hitting, scratching, pulling, or pushing. An example of this is reaching up and pulling on an individual's glasses off their face, or reaching up to yank on a person's hair. A non-example of this is reaching up to touch a person's hair or providing a rough hug to a friend. Property destruction is defined as any instance where the client knocks down objects, swipes stimuli, or crumbles paper that does not belong to them or rips apart materials. An example of this includes pulling on a trampoline net or pulling on the decal on the wall. A non-example includes knocking over chairs or accidentally crumbling on paper to throw away. For non-example includes knocking over chair accidentally or crumbling on paper to throw away. For screaming, that behavior is defined as an instance of client speaking above typical conversational level. Example includes yelling or screeching. A non-example includes cheering a person on. The intervention for inappropriate private play, which is the target behavior that will be discussed for this kiddo, will be in differential reinforcement of incompatible behavior, or DRI. DRI is defined as reinforcing a more appropriate, desirable behavior that is not able to be done at the same time as a target behavior meant for reduction. Antecedent strategies for this intervention place is to remove hands from a private area by gently tapping hands away, have an alternative item nearby ready to use, giving a clear neutral instruction of hands out, as well as verbally offering alternative item by stating, I can give you something else. The procedure to implement this intervention is that in any instance where the client goes to engage in an appropriate private play, the presentation of an alternative item of a noodle fidget or body sock is given. Once the client accepts either one of the alternative items that is being offered, we provide happy praise every time the client engages with it. An example of providing heavy praise will look like, I like that you're stretching the noodle fidget out. I like that you're using the noodle fidget instead. Way to go to getting into the body sock. How does the body sock feel? And encourage more interactions, modeling how to engage with those items when given. We will allow clients to engage in an alternative item until client has ceased attempts of engaging in inappropriate private play. Afterwards, we redirect to functional play with sensory bin, and then we follow step 1 through 3 until we transition to step 4 to complete the procedure steps for this intervention. For the consequence strategies, we transition to the bathroom with client using full physical prompting if client continues to engage in inappropriate private play after we have offered the alternative items during the DRI intervention. We continue to give clear, neutral verbal instructions of hands out, as well as use this, offering the alternative item once again. For data collection, frequency measure will be taken for each instance that the client engages in inappropriate private play, as well within an RT of 5 seconds. For the functional relevance and rationale, the function of inappropriate private play is attention and sensory seeking. DRI is the least restrictive method for treatment. DRI was used as an intervention for the target behavior because it allows for minimal attention to target behavior while providing alternative item as replacement to rule out attention-seeking behaviors. Since it is a minimal impact non-aversive intervention as mentioned by Childpuri and Benson in 2011, it does allow the sensory seeking input to be given through an alternative item, as well as providing the appropriate sensory seeking behavior through positive verbal praise when using the alternative item. It is evidence-based because this intervention was selected based off research findings of Fellner, who created a study in 1984, who also discussed the results of a combination of differential reinforcement like DRI and DRO, along with interrupting self-stimulatory actions being effective and practical for behavior reduction. For integration with the BACB task list, for target behaviors, C1 establishing operation definitions of behavior, and F6 describing the common function as probable behaviors were linked into the BACB task list. For intervention strategies, C2 distinguishing amongst direct, indirect, and product measurements of behavior, C3 measure occurrence, C4 measure temporal dimensions of behavior, G3 establish and use conditioned reinforcers, G6 use instructions and rules, G14 use reinforcement procedures to weaken behavior, in this instance being DRI, and G6 use positive and negative punishment, a response cost of requiring to be transitioned to the bathroom and using full physical prompting, a more aversive prompt in order to provide client dignity, but also be a consequence strategy for engaging those inappropriate private play. For evaluation criteria, H2 identify potential interventions based on assessment results and the best available scientific evidence. In H4, when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. And these are the references. Thanks for watching.